Hello, I'm Chris Stout. I'm a vascular and endovascular surgeon here at Ozark Regional Vein and Artery Center. And today we're going to talk about three big risk factors for peripheral artery disease or PAD. Peripheral artery disease, or PAD or PAD, as you guys will see on the internet, is a disease that affects the arteries flowing down your legs, to your arms and hands, or up your neck, or to the different organs inside your stomach and chest. And peripheral artery disease can be a blockage of that artery that can lead to a decrease in blood supply to whatever needs it, whether it be the muscles in the legs or arms, or the brain, or the kidney, or your intestines. There's some very common risk factors for PAD that lead to these blockages in the legs. Genetics is a large inherited risk that you get from your parents, and that's something that we can't change. Other risk factors that we can change are smoking. Smoking is one of the number one causes of PAD, in addition to worsening of PAD even after we fixed it. And also, probably diabetes is one of the big risk factors for PAD that can lead to limb loss and amputation. Getting into genetics. Genetics is, very interesting in what we get from our parents. I have patients that mom is, 99 years old and still going and never had a problem. But dad didn't do so well, and dad lost his leg in his 60s because he had just bad genetics because his dad had it. And those are things that we really try and tease out. And as a vascular and endovascular specialist, that, we're going to try to treat you with different medicines to help prevent that. Carrying on to one of the biggest risk factors that we can prevent is smoking. Smoking is one of the number one causes of peripheral artery disease. And if you have peripheral artery disease, there's a good chance that you also have carotid artery disease up your neck arteries that can increase your risk of stroke, in addition to heart disease. So again, smoking is a risk factor that we can modify. It's a very difficult modification to undertake. But if it is successful, and that's something that we can help guide here at Ozark Regional Vein and Artery Center, you do decrease your risk of heart attack, stroke, death, limb loss, and multiple other complications. And lastly, probably one of the largest risk factors for PAD is diabetes. And some people can't avoid diabetes. They're born with it because they don't make the insulin. And other people develop diabetes due to the way that their diet, or not exercising enough, or they gain too much weight. And diabetics are at an increased risk of losing their limbs or amputation. So if we can help modify the diabetes treatment, which I don't treat diabetes, but I can give advice on diet and exercise, and definitely get your lifestyle changed the best we can, so that we can hopefully avoid having to go in there and try and prevent an amputation. So if you think that you have PAD, like somewhere between 10 and 30 million Americans, then give Ozark Regional Vein and Artery Center a call, and we'll be more than happy to see you and evaluate you to determine if there's something that we can do, whether medically or interventionally, to help prevent complications and get you in the right direction.